Now, the challenges seem equally daunting for those needing access to mental health services. What do you tell mothers like Diane Young, who came to The Guardian after her 29-year-old son, Lennon Waterman, chose to end his life by jumping into the North River in November? What do you tell mothers like that?
First of all, you're extremely sorry. Mental illness is something that I believe today is much more on the radar screen, not only in terms of government, but of our society. 30 years ago, 20 years ago, 50 years ago, it was something that was almost swept under the rug. Today, we're actually discussing this on a year-end interview. There's discussions on it on the floor of the legislature. It's not something that people are ashamed of anymore, because you don't have to be. This is an illness, like any other illness out there, whether or not you have cancer or you break your leg. This is something where you have an illness, and we need to do our best to tackle it. Again, though, if there was an easy solution, I would introduce it. There's not. We need to make sure that there's services available out there for people that have mental illness. But, it's also about bringing awareness to the issue so that people can understand that this is not a problem. It's an issue that we have to deal with, because this is a disease. And the first thing that we need to realize is it is a disease. It can affect anyone really at any time. And I think that as a government, it's something that we need to be aware of, and we need to work with the experts. It's not about, just picking out ideas out of the air. It's about sitting down with professionals and trying to find the best solutions. And even within the professionals, there can be differences of opinion. As a government, it's up to us to sort through that and to try and find the best possible solutions.
All right. Our conversation with Premier Robert Ghiz will continue right after this.